The COVID-19 pandemic has had a devastating impact on the healthcare workforce. Despite these challenges, the staff team at Phelps Health continued to grow through a series of initiatives designed to create a culture of trust and bring all staff members into crucial decision processes. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly with AHA Communications. In today's episode, Elisa Arespacochaga, AHA's Vice President of Clinical Affairs and Workforce, sits down with Jason Shenefield, CEO at Phelps Health in Rolla, Missouri, to discuss the innovative approaches Phelps has taken to grow and sustain a healthy workforce.
Thanks, Tom. I'm joined today by Jason Shenefield, CEO, Phelps Health in Rolla, Missouri, and we're talking about workforce. So Jason, to get us started, tell me a little bit about yourself and your organization.
Our organization, Phelps Health, located in South Central Missouri. We're licensed for 240 beds. We're really more of a urban type hospital with a lot of services, a lot of specialties in a rural market. And so a lot of our challenges are really typically, as we try to meet the community need, very thin on our bench, so we struggle with recruiting, with staffing, whether it's clinical staff and nursing or allied or with physicians. But we're really working on trying to turn and create a culture to become a destination healthcare employer for our region. And so I've been the CEO for going on about 9 months now. I've been with the organization for 6 years. Previously, I had served as the chief operating officer for about 5 years. Stepped into this role, and I think the exciting thing for me is I had 5 years of kind of see what was working well and to also see what I do different if I was in this role. And so a lot of the things that I can talk about and share are things that we've actually been able to implement in a pretty short amount of time. But I think it was really just the fortune of having time to be here. And when the opportunities came up to be in this role, to be able to implement changes fairly quickly.
Great. And I think really having that lens on the organization from the operational perspective, I'm sure gave you a lot of ideas. So let's dig in on how you're addressing some of the staffing challenges. Everyone I talk to, their top 3 issues are workforce. Everything they're facing is about how do they have enough staff, how do they support the staff they have, everything being amplified and amped up by the pandemic. So how are you thinking about beyond, just the challenges you already had in bringing people to your organization? How are you thinking about bringing and keeping your team and addressing that staffing challenge?
Sure. So some of the things we did, really one of the first things I did when I stepped into this role is we did increase our minimum wage, become more competitive. What we were seeing, and I think a lot of organizations were seeing this, especially at the entry level roles, a difficulty of recruiting people because wage across the country was going up and we needed to become more competitive. We were also seeing that our turnover, we were losing a lot of people to other jobs, especially at those entry level roles. And so that was really one of the first things we did is we had to get our minimum wage and adjust, the rest of our staffing and salaries to keep and to recruit and retain. But we didn't want to rely on that as our only solution because I know that we can't just continue to raise wages and that be everything. And so what I have really talked about since I've been in the role is becoming this destination healthcare employer. And it starts with creating a culture that people know about, that they're proud of, that they want to become a part of, and really doing that through building trust with administration and the rest of the staff. Historically, administration hadn't been real visible in the organization. People didn't feel like they knew everything that was going on. So a few things that I started doing immediately was within the first month of me being in this role, we started doing quarterly town halls and getting in front of people and talking about what's going on, telling them what at first was about the change that had happened. Why was I in the role? What had led to that? And to reassure them that, things are going to be okay and that we, really the direction that we were going as an organization. The other thing I started, which has been really well received, has been every single week I do a weekly email update from the CEO. And so it's really what's going on, what do I need people to know, what's on the horizon. Try to get ahead of media. We're a county owned hospital, and our board meetings are open to the public, and we have the newspaper sitting there. And in the past, the board meetings would happen in the newspaper, write an article, and then the employees would read about it or their family would read about it and say, hey, what's this about? And the employees had no idea. So I start even the week before the board meeting saying, here's what's on the agenda. Here's what we're going to be talking about. If there's something that the board's going to vote on, I just tell them that, we'll tell you more about what the outcome is once they vote, but here's what we're asking for. And that's been a huge satisfier, because as I go around the organization and round, people, that's one of the things that come up. They're so appreciative of getting those weekly updates, and the fact that I've been doing it for 9 months consistently. They really just appreciate that transparency of what's going on. We also started an employee advisory council that we meet with every month. And really what we identify is about 30 people from across the organization. They all represent a different part of the organization. We have dietary, we have housekeeping, we have nursing, we have 2 physicians, we have people from almost every department represented there. And we really talk to them about things that we know are dissatisfiers for our employees. And we ask for their opinions. We talk about the reason why things are that way. So if there's a financial impact, or if there's a reason that it has to be from a regulatory standpoint, we help educate and explain the why, but then try to come to solutions on how do we make it better and still stay within the parameters of how we have to operate. And that's been a really big success, I would say, just because those 30 people are some of our best ambassadors of what's going on in the organization. And we also talk about that group every other week when I do new employee orientation. I share the list of all of those members, and I encourage employees to find the employee advisory council member that's close to their department, get to know who they are, and share ideas and share feedback and ask what we're talking about. And really, again, just leveraging that group. Tonight, we're kind of concluding our time off and sick leave policy. That's been a big dissatisfier for several years for employees. And so we're really presenting to them what can we do, what we've identified we can do to improve the time off and sick leave policy. What are the things that we can't do just because of a financial implication, and get ready to roll that out. And when we roll it out, we'll really say, thanks to the Employee Advisory Council for their feedback. We've made improvements, and going from there. So that's one of the topics. We're also talking about health benefits for employees. Talked about a recognition and appreciation. How do we do that better? And then the last thing we've done that I think has been really effective is we updated our strategic plan, and it was approved in December of this past year. And what I did a little bit differently with strategic planning is our board approved our mission, vision, values. They approved our organizational goals. But we didn't get into the specific tactics. And what I've done is I've created a committee where any employee can submit tactics that if they look at our goals, that they can submit ideas on how do we achieve those goals. And then this executive projects committee reviews these ideas, and when we see ideas that we can really gravitate, or we feel like we can prioritize, or that we have the resources to do, those are the things that we move forward on based off of employee feedback of where can we go. Even if I have an idea, I submit it to the same process and get the entire executive team to either support it or say, well, we have something else we need to do, or how about a different idea. But it's really a way that I'm trying to create a culture where we're empowering people to be a participant in what's going on and keeping them informed of the decisions that we're making. So that's really been our big focus on how are we trying to address those staffing challenges, because we can't change the things we can't control. We can't produce more nurses. We can't produce, more physicians. But if we create a culture where people want to be here and they're talking about how excited they are to work here and how they're a part of what's going on, I feel like that's the best way that we can recruit people into our organization.
Oh, I couldn't agree more. I'm a firm believer that probably, at least a good majority of business problems are due to poor communication. So it sounds like you're really giving folks, not only creating that communication and that knowledge, but really giving your entire team the opportunity to be part of the solution. I'd be curious how you're sort of measuring this along the way and evaluating success. It sounds like, if you're getting ideas coming in from the entire workforce, that to me would be amazing.
Yeah, I think, they're getting the ideas coming in, seeing people submit their ideas of how we can move forward, how we can achieve our organizational goals. We've really made a commitment to rounding. That's something that a lot of organizations struggle with. One of the things that, again, when I started in this role, I required of my executive team of the hours between 8 and 10 are sacred. We come in and plan our day, and then we go out and round and talk to staff. We don't have meetings. We keep those first 2 hours as time that we go out and engage with staff and find out what's going on. And so when we do that, one, it's become almost predictable. They know that we're going to be out. And when they see us, they know that we're there to get feedback and to hear how things are going. And, and I always tell people, I want to hear about the things that are in my blind spot. What are the things that I don't know about that you don't think I want to hear? Tell me about those. And people are, they're open to that, but generally I do get a lot of positive feedback. They appreciate something that I put in my weekly email, or they appreciated something that we talked about in the town hall. And I also get I'm amazed at how many emails I get from staff. Just, hey, they had an idea, or hey, they heard about something, and they're not afraid to send me an email. And I probably get anywhere from half a dozen to a dozen emails a week from staff, and my commitment to them is, I attempt to respond to everything within 24 to 48 hours. And a lot of times, I'll get emails from staff and I'll respond, and they'll say, well, I didn't even expect a response, but thank you. And so it's just, again, building that trust, building that relationship. If they don't know me as leading the organization, if they don't trust who I am or who's making the decisions, we can't create that workforce that, becoming that destination and employer. And so that's really what I'm striving for. And then we will be doing an engagement survey this fall. We hadn't done one in almost 2 years because of COVID, just kind of fell to the wayside, but I'm really excited to see what feedback do we get from that, and then work on how do we really make that actionable. And again, get their feedback. Once we have the survey results, how do we correct the issues where we see that there's deficiencies?
Absolutely. And I'd be remiss at being me pretty much if I didn't ask you sort of how you're involving your patients in this work, because I think obviously we're all here for that purpose, to help serve our communities and patients. So how are you reaching out to, or involving, or have you maybe not gotten to that committee yet, to include your patients?
So one thing that we did, I'd actually set up, it's probably been almost 4 years ago, is we created a patient family advisory council. And so it's a group of about 12 to 15 community members. We really try to get a few people we have a 7 county service area, and we try to get people from each of those different counties, because our presence in those communities are a little bit different depending on the services we provide. And so we really, value getting that input. But we take some of the same issues, things that we know are dissatisfiers for patients, and we ask them, what could we do? What would better look like, or what would ideal state look like? And again, having the conversation of, a lot of times there's great ideas, but there's limitations, whether it's joint commission, or whether it's a financial constraint or whatever. But again, having that conversation about the why, and then coming to what's a good medium place to agree that, better could be this. And so that's been in place for a little while. One of the things that I plan to do, and I just haven't quite gotten there yet in the time I've been in the role, is I want to start doing, probably on a quarterly basis, kind of like fireside chats, and invite about 20 people from the community who maybe haven't been real engaged with the organization, and just talk about what's going on, ask their questions, and really create an environment to where it's a little bit vulnerable for me, because I have no idea what the people are going to ask, but try to get different people in, and again, reassure them about the direction that we're going, the things we're working on, and hear their feedback on, what would they like to see us do, and making sure that we're aligned. So that's something that'll be coming up, really probably started around the middle of this year, to get those going, probably on a quarterly basis.
That just warms my heart to hear, because I think that's absolutely, that's why we're here. And so, really getting that directly from the patients, as well as all the work that you've done to engage your employees, because they're obviously also part of your community. So tell me a little bit about some of the challenges or stumbling blocks. Where are the places where you might have faced a little more of an uphill battle in creating some of these groups and putting these resources together for the team?
I think some of the biggest challenges is allowing time for planning. If I didn't really structure the time or plan the time in our days to do these things, it would be easy for them to fall on the wayside. And so one of the things that, as I mentioned, we protect the 8 to 10 hour for rounding and for planning time. But I've really challenged my team. It seemed like historically we had been very, as a COO, I would get invited to all kinds of meetings and I would sit there and I'd say, I'm not really the one that needs to make a decision, but because I was the highest position in the organization, people would look to me to make a decision. And so we've really tried to bow out of more meetings and empower our other leaders to make decisions, making sure that they're getting feedback from their staff, the people that the decision is going to impact, and make it to where it's not an executive or vice president making the decision every time. And so by doing that, it's empowering the people, but it's also freeing up our time to focus on, like, for instance, today I've been working on the agenda for the Employee Advisory Council and fine tuning our presentation for that. If I was in meetings all day, I would be probably running into that meeting just kind of winging it. And I think that I can provide a much more meaningful conversation for a very important group and a very important topic. I had to change the way that I allowed my work to get done and where my time was prioritized. And so I think that was the biggest, it still can be a challenge because it's easy to get consumed in new meetings or new invites or, things out in the community where people want my presence. And I really have to make sure that I first and foremost plan the time to get the work done that's meaningful here for our employees and for our patients. And then what my calendar allows is what I can do beyond that.
Oh, absolutely. Or else you're doing that presentation at, 10 p.m. on a Friday night instead of spending it with your family, which I applaud you for modeling that level of well-being, even for yourself, putting those appropriate parameters in place of where your work belongs and where others do, and really the ability to make it better for everyone. So what advice would you share with those who are listening, who are working on recruitment and retention strategies and trying to figure out how they're going to be able to support their teams and bring in new team members? If you had to give them some words of advice, what would they be?
I think the most important thing is getting the staff involved, getting their input, really giving them a voice, giving them a venue, and not just one, but giving them a few different venues in which their voice can be heard, their ideas can be shared, and that you also follow up on the ideas. There's no bad ideas, but there are things that, there's times where I've said, well, we're not going to be able to do that now, but this might be, 2 years down the road or 3 years down the road, and here's why. And I think that has been the most powerful thing that I've seen, is just allowing people to have a voice and that they know that they're heard and that they know that their opinions and their thoughts are valued and that it's actually making a difference. I think that they are employees that have taken the opportunity to share feedback or to give us input, really feel like we truly hear them. And I think that that's one of the most powerful things. As you mentioned with patients, I think that our Patient Family Advisory Council, it's giving people in the community that voice and that platform to share what they want. And it does help us stay grounded in why are we here and not getting into going down other paths that really aren't really representative of why we show up to work every day. So I think just getting that involvement from staff, from patients is probably the most critical piece, because it's easy to leave them out when you think you're just doing the right things.
Oh, absolutely. So as you think back on the last 9 months and then the 5 years before that, 6 years before that, what sort of surprised you as you put some of this work together? Obviously, you had that opportunity to sort of observe some of the things that you do, but I'd be curious, and maybe is from a couple of lenses, as you put this together, what are the things that surprised you from your team, coming maybe from your board, which is your community very much, and from those different angles, what were the things that really caught you to say, oh, wait a second, this is not what I was expecting?
The thing that surprised me the most was how quickly it seemed to make an impact. And I think that what we saw was one comment that I heard several times was, after probably 2 or 3 months of me being in the role, was it felt like a breath of fresh air. And I heard employees say that it's like, there's going to be real change. And they really felt like they believed in the things that we were doing. And I think initially, probably in the first 6 months, they were kind of saying, well, is it sustainable? And now that we're kind of at this 9-month period and we're still being consistent, you can feel it in the culture. You can feel it in people's moods. You can feel it in the way that people approach the work, and just a little bit more optimism in where we're going. So that was a surprise because I didn't really, a lot of these things where it's kind of a combination of my experience over the years. I've been in healthcare for 27 years. I've worked for a lot of really excellent CEOs. And so a lot of these things are like bits and pieces of things I've learned and then put it together in my own way. And so I didn't really know how, if I put all this together, how will it work? And I was kind of surprised that it was kind of more on the mark than I expected. I think the thing that, I know you're asking about what surprised. I think the thing that I think a lot about is again not losing the momentum. And I think we're as you get to we're at the 9-month period, as we get to a year, how do you continue to sustain that momentum? And I think that's for me, that's what I'm curious to see. Doing the same things, does that continue, or do we need to mix it up? And but again, one of the things we're doing this week is we're actually doing a quick survey on town halls and saying, what's kept you from coming to a town hall? What would help you be more interested in coming? And if you've come to one, do you prefer in person or do you prefer a video? And trying to get a little bit of feedback so that we can tweak what we're doing so that we don't just assume that the same old thing is going to have the same impact. So again, trying to continue to get feedback. But I think the biggest surprise is just how quickly it started to come together. And now I'm just really focusing on making sure we can sustain it over time.
Well, I would say even sustain and improve. I love that you're continuing to look at it and say, okay, this is good. This is great that we're making progress, but what else could we do? I think that's just such a great approach. Well, Jason, thank you so much for sharing the great work you're doing, and just kudos on having just such a great vision and a team that wants to be where they are doing the things they're doing. I think it's just a great testament to your leadership.
Well, thank you. I appreciate that and appreciate the chance to come and share it with you.